mynews.studio.
A patch of gel that speeds up healing for diabetic wounds, from months down to days. Could this really change lives everywhere?
Today is August 8th, 2025. Diabetic wounds, especially foot ulcers, can take months to heal. Many end up infected, and in the worst cases, lead to amputations. Now there's this new smart gel people are talking about. What exactly makes a difference?
It comes down to what happens at the cellular level. The gel uses engineered extracellular vesicles, specifically called MIR221OE-SEVs. These vesicles suppress a protein named thrombospondin 1, or TSP1.
Wait, TSP1, why is that important?
Good point. TSP1 actually blocks new blood vessel growth, which is something diabetic wounds really need to heal. So by suppressing TSP1, the gel helps new blood vessels form.
So letting those vessels grow means better oxygen and nutrients reach the wound. But how do they get those vesicles into the actual wound area?
They embed the vesicles into something called Gelma hydrogel. This hydrogel mimics the body's own tissue and gradually releases the vesicles right at the wound site. Think of it as sending in a mini repair crew exactly where they're needed.
And the results in animal studies sound striking. They saw about 90% wound closure in just 12 days. That's much quicker than what's been possible before. But these are still animal trials, right? No big human studies yet?
Correct. So far, it's only been tested in animal models, mostly diabetic mice. That's a significant limitation. Moving to clinical trials is the next big hurdle. And with new technologies like this, approval can take years.
Scaling this up is going to be tricky. Manufacturing both the vesicles and the hydrogel at a consistent high quality isn't simple. If production varies, so do the results. Plus, many countries don't have the supply chain set up for these biomaterials.
Absolutely. And then regulation is another obstacle. Safety and effectiveness have to be shown, especially for advanced biotech. Also, in lower income regions, building facilities, covering costs, and getting through import rules make access even tougher.
What about cost? Do we have any sense of how this gel compares to what's used now? Is it likely to be affordable where it's most needed?
At first, it'll likely cost more than basic dressings or gauze, but if it cuts down on infections, amputations, or long hospital stays, the overall savings could be significant. Making it affordable will depend on scaling up, sharing the technology, and building global partnerships. But we need real-world data before we can say for sure.
Could this type of gel be used for more than diabetic wounds? I'm thinking of chronic wounds from vascular disease, or even helping with bone and cartilage repair.
The science behind it could be useful for other conditions. The idea is the same. Target what's preventing healing. Deliver therapy right where it's needed. But every condition comes with its own hurdles, so adapting the approach will need more research.
Stepping back, diabetes is only becoming more common. More than 500 million people worldwide are affected. Chronic wounds are a huge burden, not just physically, but emotionally and financially too. Traditional bandages just aren't enough.
Exactly. Smart hydrogels like this could change not just how we treat diabetic wounds, but how we understand healing overall. It's a step forward that could have an impact far beyond one illness.
And it all started with a simple question. Can we help the body heal itself, but faster?
That's really the core of it. Thanks for listening as we explored how a smart gel could change wound care and maybe prevent millions of serious complications.
If you want to dive deeper, check out studies on newsmedical.net, Science Daily, and Frontiers in Bioengineering and Biotechnology. Thanks for tuning in. This episode was brought to you by mynews.studio. Give it a try. It's free.